Now, when we talk about the vision or the visual acuity in an individual, it's basically the clarity of the vision that we are calculating in that particular patient. Now, how is this visual acuity calculated? The normal methods that are used for the calculating of this visual acuity are the usages of the Snellen's charts, and then we have the other varieties such as the EDTRS or the 2020 varieties that are quite less commonly used, and the most commonly used methods is the Snellen's chart. So basically you ask the patient to stand at a distance of 6 meters, and he or she has to go through that optotypes or that list of the optotypes that are available on the Snellen's charts, and this is how you go about and calculate the visual acuity. Now there are the other factors we have to consider while we are considering the vision in a person. One of the other factors is the color vision that can be affected in that particular individual. So this aspect cannot be ignored. So there are the different charts ranging from the Ishihara's, and then we have the Pete Robbins charts that were developed, and it is basically going to differentiate between the red-green color blindness and the green-red color blindness. These are the different kinds of color blindness that are usually seen or diagnosed in the patients, and one should know how to distinguish between these individuals when we go about them. So in this section we're going to focus on the terminology of vision. How do you go about and define this terminology? Then color vision, we're going to assess the factors or the techniques that are usually devised for evaluating color vision in the individuals. And then we're going to go about and discuss the blindness. So there are the different causes of blindness out there. And we've already discussed that's quite a prevalent disorder. Its incidence is quite common even in the Western countries, even in the developed countries. The causes can range from cataract, that is the most leading cause, causing about 70% of the blindness in the individuals. And then we have the other causes ranging from trachoma, glaucoma. So all of these diseases cannot be ignored if we have them in our outpatient department. So if we see a patient, if we look at a patient, one should know how to assess and how to go about and manage these cases quite vigilantly, because these diseases can end up in blindness of the individual, which itself is quite debilitating for the person and for the society, for the people who are surrounding that individual. The family, the close relatives are affected due to this disease. So one should know how to vigilantly act upon these diseases and evaluate the causes and treat them, evaluate the risk factors, and go about managing these cases over here. So what is vision? We have the contrast sensitivity. Pelley-Robinson charts are used for this. We have the grading systems that are commonly used to evaluate the color sensitivity in the individual. Over here in this picture, it's basically how a person of macular degeneration would look at these individuals. This is how we basically go about and see or look at these individuals. Then we'll go about and see the peripheral vision. So sometimes the visual fields are also affected. There are different tests ranging from one of the methods is the topometry, that is sometimes devised just to see what visual field is affected in that particular person. So the normal testing is usually subjective between the patient and the examiner, and if something is abnormal over there, then you're going to add on the additional tests of the topometry in that specific individual. The visual fields are usually regarded as the supratemporal, then we have the infratemporal, then we have the superior nasal field, then we have the inferior nasal field. So usually these fields are affected, and these are the terminologies that are used to identify which of the visual field is affected in that particular person that you're dealing with. The kinetic and static methods are usually used. Now, when we regard blindness as almost if the vision is 20/10 or 20/25, it's normal. Then we have 20/30, 20/60, it's near normal. Then we have 20/70, 21/60. It's the moderate visual impairment eligible for the education assistance in US. Then we have 2200 or 2400. That is basically a severe visual impairment. Legal blindness in the US is basically this state, this level that we regard the person as to be blind by legal authorities. Then we have 2,500 or 20,000, that is almost profound vision impairment by WHO. Several European countries' definition of blindness is regarded at this level, and then we have the CF at is less than 3 meters, that is near total visual impairment used by some developing countries as definition of blindness. Visual field is usually less than 5 degrees in these individuals. And then we have the total visual impairment in which the light reflexes are absent and in which the hand movements are even negative. HM basically stands for the hand movements over here, and even the person cannot identify the hand movement in any of the visual field. So this is basically regarded as to be the total visual impairment over here, or the criteria for the total visual impairment over here. So if you look over here, at the total visual impairment, we don't have any light reflexes, we don't have any pupillary reflexes, the visual fields are completely affected. It's not at only one field, whether it's peripheral or central, it's going to be a complete blindness in all of the visual fields for that particular person. Now, the causes of the blindness can be trauma, that can be recreational, work-related, military. And then we can have the systemic diseases that can be diabetes, vascular diseases, hypertension. It can be aging or the eye-specific diseases in these individuals as well, and can relate to cataracts, age-related maculopathies, and then we have glaucomas. Infections can one of be the leading causes of the vision loss or the blindness, ranging from trachoma, onchocerciasis, and then we have the immunocompromised individuals who can get affected again by the trachomas or the other infectious diseases in these individuals. Then we have the congenital or the hereditary causes ranging from the cataracts, malformations, glaucomas, and the retinal degenerations in these individuals. We have the nutritional and the toxic effects of the vitamin A deficiencies, methanol, and then we have tumors such as the metastatic tumors can also manifest as blindness in these individuals. So this is basically a range of the causes that can result in the visual loss. It can be a partial vision loss or it can be a complete vision loss in that particular person that we're talking about over here. Which can result in the complete impairment of the vision in these individuals. It can also be the primary malignancies of the children and the adults that can relate to the vision loss. Then we have the causes of infectious loss ranging from trachoma, affects 500 million people, estimated 6 million people are blind. Then we have the onchocerciasis that is endemic across the equatorial Africa. Some areas of South and Central America are also affected. We have the 80 million exposed, 18 million infected, 2 million are blind, transmitted by black fly, filial nematode, and treatment is the vector control. Ivermectin is sometimes used. We have the other causes such as leprosy and syphilis, estimated as 10 to 12 million cases of leprosy. WHO estimated that 250,000 blindnesses are caused due to the leprosy or the syphilis each year. So in this section, basically, we summarize the different causes for the visual impairment or the vision loss in the individuals and how to basically calculate the visual acuity in any patient. So that is the end of the section. Thank you for watching sqadia.com.